घाव में मुझे निकालने का मन नहीं पड़ता, लगता है कि मन बारू आ पड़ी है आँख में। ये नहीं आता है धूप में, जैसे यहाँ घाव में मैं निकल तो आँखी के तन हाथ लगा के चलो, आंसू बहा लागत रहे, रात में चिपक जात रही है आँखी, आंसू बहते रहत रहे हैं आँखी में। फिर दिखाऊँ गई, फिर वो जाओ बने लायक रही आँखी, तो फिर बनवाई। फिर एक के बाद दाई आँखी बनी 2 साल पहले, जिन्हें से बन गए तो भैया चश्मा लगाऊं कभी ले तो ना लगाऊं कभी नहीं। बहुत खुशी भाई, जब एको नहीं दिखात रहा, जैसे लड़का बच्चा उनका देखा तो धूमिल धूमिल, तो बढ़िया साफ सुथरा चेहरा दिखा नू खा, बढ़िया हंसा भरा।
My name is Nakul Shekhawat. I'm an eye doctor at Johns Hopkins and a co-founder of Visilant. We are building accessible, AI-powered eye screenings to eliminate avoidable blindness. Nearly 20 years ago, I volunteered for a vision screening program in rural India, close to where my grandparents are from. Our team of eye doctors drove hours to a small desert village. There, 200 patients were waiting to be screened for blinding eye diseases, hoping to be selected for sight-restoring eye surgery. We could only visit that village a few times a year, and so desperate patients fought each other to reach the front of the line, terrified they would miss their chance to regain their vision. These patients had to be let in by hand because they were blind, but after surgery, they could walk, see, and regain the independence and dignity that had eluded them for years. And that was the day I decided to become an ophthalmologist. I then spent the next 12 years in medical training, learning to perform sight-restoring eye surgery. But one problem has always haunted me. There are 1 billion people with blindness or visual impairment worldwide, but only one ophthalmologist for every 100,000 patients needing eye care. A few visits a year just doesn't cut it. How can eye doctors possibly reach those who need us the most? The majority of blindness is preventable and treatable. If we could make eye exams easy, mobile, and affordable, we could bring care to those in greatest need. And that is our mission at Visilant. We've developed a low-cost smartphone imaging system that anyone can use. Community health workers with no prior eye exam experience can use it to take pictures of patients' eyes. Our device is fast, easy, and produces clinical-grade images. Our AI algorithms then analyze these images, diagnosing conditions like cataract, corneal infections, and ocular injuries with over 95% accuracy compared to in-person eye exams. And finally, we connect patients to in-person eye care with instructions, notifications, and reminders. Thanks to Visilant, rural patients who used to travel 8 hours to the hospital can now receive highly specialized eye care close to home. Eye exams that used to be expensive and difficult to perform are now accessible to anyone, anywhere in the world. Visilant has already validated our solution by partnering with the largest eye hospitals in India. To date, we have screened over 30,000 patients. And because barriers to eye care are universal, we have seen strong interest in our technology from doctors and health systems in the United States and around the world. Our team has expertise in ophthalmology, biomedical engineering, and digital health. We developed and validated our solution at Johns Hopkins University. Now, Visilant is ready to scale globally. We want to bring our solution to every person in need. We are raising $2 million to secure FDA clearance and expand across India, the United States, and beyond. Last week, in my own practice, I helped one blind patient see again. Next week, with Visilant, we are poised to help thousands more. Join us to help the world see.